All right, so let's continue on. We're going to talk about SPECT scan first, and it's episode 108 of ADHD Superpower. So, what is a SPECT scan? SPECT stands for a single photon emission computed tomography. That's a mouthful. Yes, it is. So, here's what it translates to. Patients are injected with radioactive isotope that emits gamma rays. As the isotope travels through the patient's bloodstream, it can use to emit radiation. We know how that sounds, but it's really safe level of radiation. I've done it before for my hip when I did the contrast MRI. A special gamma camera is positioned above the patient and are able to detect the gamma rays emitted by the isotope. A computer then triangulates in a three-dimensional space where the gamma rays are coming from. It's interesting, huh? In other words, it looks at multiple data points to figure out where the isotopes was in your body when the radiation was emitted. Over time, collecting multiple images can show physicians if blood flow in your body has been impacted by your condition. Note though, however, you may be more familiar with a PET scan, which is positional emission tomography. The imaging technique is very similar to SPECT, but SPECT is newer since both use radioactive tracers to investigate blood flow. PET has greater resolution and fewer image artifacts, but it has other drawbacks as well. SPECT scan can be used to look at heart, brain, and a few other things. And Dr. Amen will scan anything. I'm talking about like, here's a light, here's a USB light. He's gonna scan this. Here's my vape. He will scan it. Here's the lighter. He will scan it. Here's my pipe. He will scan it. He will scan everything. So scan my fucking brain, man. I want to know what it's like when when I have ADHD and talented or gifted or whatever. I'm not pompous, but anyways. Because of that, I can identify certain conditions better than others. If you had a concussion, brain SPECT imaging can confirm whether you have or have not sustained the brain dysfunction after the injury. Unfortunately, it often cannot provide more detailed information about specific regions and how they were affected. I would suggest you go on YouTube and start listening to Dr. Daniel Amen, A-M-E-N. He is the number one SPECT scan doctor that in the world, I guess, in North America. So anyways, yeah, they were gonna book my SPECT scan, but I have to fly from my way down, from here down to the States and either New York or Chicago, and so we'll see. We'll see if I can do it here in Canada if that works. Then, but I want Dr. Amen to be able to tell, like his team, to be able to tell me what exactly what my brain is like when I am on methylphenidate and when I'm not on methylphenidate, because I know there has to be a change that only functional MRI or SPECT can detect because the MRI didn't. So, anyways, take care. Next episode. See ya.